Hello and a very warm welcome again to Sweet Omagh Internet Radio. Calling Mr. Ford, are you home tonight?
I am at home listening to the phone. How are you?
I bet you're sitting waiting when's McGurgan going to ring.
I'm battering up the windows here and locking the door.
Any excuse to get out of the garden, Declan, isn't it? Yeah.
Well, anyway, what's on the agenda today?
Oh, well, we're still under house arrest, I believe, so we still have to keep making each day count as it does.
Well, we'll just keep the home fires burning.
Absolutely.
That's all we can do.
Yeah, we can.
One day at a time.
Sure. You know, it's one of those things, it's a lifestyle and we have to get used to it. Whether we like it or not, we just have to try to get this wintered out. But
well, that's it.
Anyway.
We'll get through the summer first.
We're going to lose the summer, I think. Best part of the autumn as well. But sure, what is it about? Anyway, I've been rummaging around the little boxes of recordings, and do you remember we had a wee Strull FM station going in town here? Was it 09?
Yes, I remember it well because we won a Sony Award for it.
What did we get that Sony Award for, do you think? I didn't realise at the time. I thought that was just a wee piece of plastic. Actually, it was quite an award for a young community radio station, first year out of the trap, I could tell you.
Oh, I know.
I didn't realise it was...
I don't think we realised, what we had achieved in such a short period of time.
Because,
how many years ago was that? Was about
09.
09.
11 years.
But I did some great interviews.
We had some good
ones. Some great people.
And sadly, not many survived, but one has survived, I should say, and that was one with Dr. Jamshidi and Dr. Law. And that was sort of during the campaign to save the hospital, or at that stage maybe all may have been lost or whatever. But they came in to talk about the hospital, and I think we'll let that out tonight just for people to hear. It is a wee bit dated in that sense because things have moved on considerably since that. But it let them see the life of the hospital and the impact that hospital had and the support that was for us in this community for countless years. Oh
yes, I mean it was an impressive building, and as I told you, I had an aunt who worked in the hospital for many years, Eilish Keown, and my mother was a patient for many years in the hospital as well. So my wife's aunt trained at the hospital. As I say, my aunt loved the hospital. It was a wee bit like what Brian Mullen talked about with the TNF. It was a little community of its own.
Well, when you think, sorry, I cut across you think Tom Wilmot set up the whole ENT department there.
That's right. I remember my aunt talking about him. She worked with him.
Yes.
And yes, his name would have cropped up, yes. Yeah. So he set up the ENT.
He would have came there. We interviewed him the time we had the little hospital radio going there, and he came in to talk to us one day. He had retired at this stage, and I laughed because he had retired. He wasn't obviously a doctor in the hospital, but there was something going on outside. They were going or doing some sort of work. I says, "Doctor, I'm very sorry about the noise. We can't do this till this noise stops." He says, "Hold on a minute." He says, and he goes out, and I could see the finger going. And the Kango went off. He says, "Continue." So, he may have retired, but he still kept
a man of authority.
Oh, indeed he was, all right. And you think they had, the whole maternity service was there, and a renal service there, and was a teaching hospital, and nurses trained there.
Right.
It really was well ahead of its time for a very small town in Omagh, sort of 60 miles west of Belfast when you think of it now. We did lose a lot, I suppose.
So, tell me, there was a plaque at the back of the hospital.
Yes.
Oh, was that? And there was a picture of a man with a pipe. I think, was he one of the first consultants in the hospital? I
think the sign reads something like, "To live in the hearts we leave behind is not to die."
That's right. That's exactly it. And if anybody out there has any memories, for goodness sake, please get in contact with us.
Oh yeah, we
better share your memories or your stories.
Please
if you were a patient, or on the medical staff, or the ancillary staff, or the catering staff, whatever. Yeah. And if you want just to tell us your memories of the hospital, please get in contact.
And we'll give the details. The mobile to contact us on is 07717325527 or on Sweet Omagh Internet Radio. You'll find us on YouTube or on the Facebook site. No, it's it'll be lovely just for people to recall the memories and give us a wee flag or a wee thumbs up because we don't get these shares now on Facebook as we should do because of the numbers that are actually listening to us, Declan. So if you do share it, if you do like it, maybe share it with your friends because it's probably the only way they'll get to hear it. But No, I mean the hospital itself. I mean, there was a whole regime and a whole structure in there, and the nurses used to stay in the nurses' home, and then would have had to get passes to get out at night and various things like that. So we'd love to hear those stories and your memories if you'll be kind enough to share them with us. As a hospital it was, and then obviously the matron, and you had the whole hierarchy there of the nursing staff and the administration staff. And we had a little hospital radio station going there for many years before you were born, Mr. Ford.
I've no doubt I could see you with your wind-up gramophone.
Michael MacDonald was the man who set us up. Your friend of mine,
really?
The late Michael MacDonald. Michael was the technical guy.
Michael MacDonald, he was a character, wasn't he?
Oh, dear Michael,
I was involved with him in a number of plays, and he was a man who did things right.
And he got that right because, I mean, we had strict guidelines to follow, because that was the headquarters for the ambulance station as well. We weren't allowed to use any transmitters or anything. We had to use this, but because Michael worked in BT, he's fit to jump into the internal phones, then amplify the signal back in the wards. It worked in a fashion, but obviously the parts of the hospital were quite new and modern, and the older hospitals didn't have the number of circuits and telephone lines going through them and various things. But it worked, and we got requests, and then of course the whole thing changed because patients were no longer staying in hospital for any length of time, so the days of people staying in for 2 or 3 weeks sort of disappeared down to 2 or 3 nights, and then overnight, and we lost our audience, thankfully, and I suppose it just ran out of time. Well,
if you see the patients, could they access the radio as well? Say programs from Radio Ireland or BBC?
There were 4 presets taken from memory. One in the BBC hubs, or Radio 2 and Radio 4 possibly.
Right.
And then Radio, the hospital owned that was theirs, and then they gave us a channel 4, and we could switch from all that, so that for 2 hours a night from 8 o'clock to 10, the hospital radio became live, and then we got presenters in who sort of, locals from the town who had their own record collections and came in and would sit and play their music and talk and interviews. We got some lovely guests come in. I remember Daniel O'Donnell came over, and who else? God, I don't remember offhand now, but quite a few. I remember Jean Fitzpatrick coming down and being interviewed.
Right.
And anyone who's going in and around the town, we could have got in at night with a wee portable recorder and let the people say, there's a concert in Knocknamo Hotel. If whoever was performing there would have given us 5 or 10 minutes of their time.
Right.
So it worked very well, because there may have been 10 or 12 of different presenters doing different things, and then we had a gospel program on a Tuesday night from memory, where guys would come in and play their gospel music and read sort of passages from the Bible and various things, and then we had traditional music with all shapes and sizes for all tastes.
And did any live music feature? Or was it all records?
It was all records and all pre-recorded. Right. We wouldn't have the facility of the microphones in the studio to cover something like that. But the guests would come over. Now, I can't remember who else came over, but there's quite a few people, quite a few TV stars and people who were doing the round. The guy, was it Johnny Briggs? Was it in Coronation Street?
Oh, right. Oh, remember, he ran the factory in Coronation Street.
Aye, he was over here. He came round the wards with us one day. And then Paul Clark was a patron. He came down and did the odd programme as well with us. And Ben Kelly was a patron, and he gave interviews. The late Paddy Laird as well, and Paddy Mossy. They're all come out, people come out of the town, all very good, and all mucked in to give us a hand. And it was
good.
Ahead of its time, I suppose, but then it's nothing lasts forever, as you know, Declan, things move on. So.
Yeah. Well, you know what? It was a great example of genuine community radio.
It was of its time, yeah. It really was now. Right.
And a great training ground.
It was great because one of the guys went on to work as a senior producer now in Radio 1.
My goodness.
I don't want to name him because he thinks he's sort of guy who wouldn't want to be his name dropped, but he came to us as a young guy to collect requests and various things, a very quiet young lad. And I'm not sure how I got him into Radio 1, but I wrote a letter from a reference for him to go over to Radio 1, and he got round, and he was offered a part-time job and then a full-time job.
Brilliant.
And some years later, I had a young girl with me who wanted to stay around Radio 1, and I contacted him, and she went over and stayed in a hotel. The next morning, the taxi came from Radio 1, and this guy met her at the door and showed her, and she spent the day round with Radio 1. He was a senior producer at that stage. And he says, a bit like yourself, Declan, with your man McGarvey. Maybe you'll tell us about him, but this guy went on to work in Radio 1, and his town is Omagh and still is from Omagh, and I do I see him or talk to him occasionally, still on the phone. So it's wonderful, how humble beginnings can open doors for people right enough now.
Oh, well, that's it.
Yes.
Well, I look forward to hearing this interview. I haven't heard it in 10 or 11 years.
You just before I go, that guy McGarvey, maybe explain to me who he is, because I know I'd read it before somewhere about it.
Oh, I taught him many years ago in Armagh. He now lives in Tuscany. He's possibly one of the greatest cinematographers in the world, and very talented young fellow, and like the young man you're talking about, a man of great modesty.
Yes,
and he never forgot his hometown, and I think that's just I think it's a mark of where he was reared, and the impact that was left on him, So,
well, funny to say that, because
young people like that doing well,
No, it's great. And funny, he was interviewed on I think it was Parkinson's program or somewhere. I remember hearing him saying that his art teacher gave him an old cine camera when he was a young lad. I take it that was your dad's camera you gave him. That's right. Oh, well, look, he did well.
Okay,
well, we'll leave you in the company of the Tyrone County Hospital for the next hour or so. Thanks again, and take care of yourselves, and we'll talk soon. Bye. Very good day to you, afternoon, morning, whatever it may be. You're listening to the sweet Omagh town, Voices of Omagh, with myself, Don McGurgan, and Declan Ford here for a while to chat to you. And our guests today are Rustam Jamshidi and his wife Rosemary. Hello, and you're very welcome to the programme.
Pleasure.
And we're here to talk today primarily, I think, about the county hospital and your time in the county hospital, and subsequently then your time in Omagh. And what do you think, what Omagh means to you?
Well, Omagh has been really a haven, a refuge to us. A wonderful place, wonderful people. And in early days, we were so busy in the Tyrone County Hospital, which didn't give us time to think of anything adverse, rather than trying to be service to humanity, and that was a great privilege. So that was our impression of entering Omagh, and that continued for many years, and in some ways is still going on. But circumstances have changed, and well, naturally the feeling changes as well, But such is life.
Well, we'll begin at the beginning. When did you come to Omagh?
It was in 1982.
Yes, well, it's over 30 years ago.
It's over 30 years.
30 years.
And of course, the way things were, in the hospital, Mr. Patterson passed away, and then they were looking for other people. And in Belfast, if anybody talked about a position outside Belfast and in the country, there was kind of frowned by some people. Oh, I'm not going to live in that part of the world, And of course, then one day the professor asked me, would you be interested in going to Omagh? Well, I said, certainly. Mm-hmm. Why not? If they would have me, Mm-hmm. And then I came for the interview, and they were kind enough to take me on. And I joined the crack in Tyrone County Hospital.
Did it seem like a culture shock for you at the time?
No. I found people so lovely, caring, friendly, and there was nothing to tell me, what are you doing here? You should have stayed in this, in the city,
Well, then, so prior to Omagh, you were based in Belfast?
We were in Belfast, and then the job came up in Lurgan, and we're Lurgan, and then Lurgan became Craigavon,
The new hospital in Craigavon.
Yes.
Where did you train?
Queen's University. So, wonderful place. A place that really accommodated the people from other parts of the world who had difficulties with language and culture and everything. But Queen's University seemed to be open for that sort of thing, and hospitality spread all over.
And that would have been Belfast just prior to the Troubles
It was prior to
in 1969. And you found Belfast a welcoming place now?
Absolutely,
And
yes.
Where then did you come from?
Where
Where
I originally was born in Persia. Then, of course, when my father was young, he went to India of those days because you see, he was from the Zoroastrian background, and in Islamic country, they weren't given jobs, anything like that. So he went there to get something doing in life. Then he came back to Persia, married my mother. We were born there. And when I got a little bit older, and Dad was in Pakistan, which had become, and I said, well, why can't I go with Dad and see what's it all about in there, you know? So eventually I went to Karachi, which is in Pakistan. And when I was there, well, Dad looked around, and of course, originally I was interested in aviation, so I was going to be a pilot. And Dad was happy about that. But one day he asked me, why do you want to become a pilot? I want to become a pilot to serve people, you know, take them from one part of the world to another and bring joy to them, you know. So fine. So he must have communicated with Mum, who was still in Persia. So one day he asked me, well, you have decided to do aviation, okay. But if you decide to do something else, I will send you to Britain to do it, like medicine, you know. I said, oh, right, Dad, leave it with me. I'll think about it. So I spoke to him after a few days and said, all right, Dad, you're on. So Dad decided Britain is the place I'm coming to. So he got to the National Baha'i Assembly of Britain and asked their advice where should he send his son to do medicine. And they suggested either Edinburgh or Belfast. We hadn't heard of either of the places. I had no idea. But we thought, well, B comes before E, so we'd come to Belfast.
Good a reason as any.
Uh-huh.
Well, was your father a medical man? Or what
No,
was
he was just busy. Well, they were from a very poor family. And as I said, you know, there were no opportunities for them in Persia, so he went to India of those days to get into some sort of job. So he was taken in as one of the floor workers in one of the restaurants, and then gradually worked his way up. So he loved education, he loved reading, but there were no opportunities. So he made absolutely sure that his children get what he didn't.
He was very ambitious for you?
Yes, absolutely, without forcing.
Yeah.
And we're three brothers, and all of us been very lucky. Three of us were educated at Queen's. One qualified as a pharmacist, another one as an engineer, and I had the privilege of qualifying in the medical world.
Do you think, deep down, had he already identified that these are what my sons will do? I want medicine, pharmacy, engineering, or was it just education and to achieve the best?
Just
you can?
education and what they wish.
Yeah.
But it emphasized the importance of service to humanity, because that is the purpose of creation. that we are created, we are given the gifts in order to serve the children of God. So it's wide open. Try and find out what you like to do.
And did he come over to Belfast to see you at all, or did he ever?
Oh, they did, yes. Mum and Dad came to see us, after a few years of being here. And Mum passed away, in her early 60s, and Dad was he was living with my sister in Karachi, and then he developed Parkinson's disease, and it was pretty bad. So I decided to go and see him.
I see.
And when I saw him in that position, I found it very difficult for my sister to look after him, really.
I see.
So I suggested, did he want to come to Northern Ireland with me? And he said, well, whatever you think. So we decided that he should come to Northern Ireland. And then I had a return ticket to Belfast. And I thought, well, it would be nice to take Dad with me. I went to the travelling agent and asked, are there any seats left for that particular flight? He said, there's one more seat. So I said, well,
that's fine.
God has provided.
Yes.
So we got the ticket and we brought Dad here. And he was in Omagh General, as used to be, which is not anymore now. And he passed away, and he is buried in Green Hill Cemetery.
It was his first time to Omagh as well. Had he been there before?
It would have been his first time to
Omagh,
Yes. So marvellous altogether.
So there you are. The way the good Lord decided.
Indeed it
really,
does. Indeed it does.
The door open. If
Indeed.
he wants, happens. If he doesn't want, it doesn't. And
Well,
that's the
Indeed, but we'll
that's the
continue.
height of it.
We're joined now by Kate Law, retired ENT surgeon. You're very welcome, Kate, to our merry band to talk about the Tyrone County Hospital and your time there.
Thank you.
And the change times, of course.
Yeah, sadly changed times.
And not for the better, I
But
think.
no, not for the better for the people of this area. But I came to work here in 1974, and I was supposed to be here for a year, but I stayed a bit longer and retired in 2004. I think what I noticed most about Tyrone County Hospital was the teamwork. Now, we had a team of nurses that were second to none. And if we as doctors now and again seemed to be a wee bit lazy about it, walked on by when we should have stopped, it wasn't too long till we were pulled back again. And because of this teamwork, I think we had some brilliant successes which we would not otherwise have had. Our focus at all times was just one person, the patient. Now, patient is not a modern word at all. We've gone on to something called a client. Now, I'm not terribly happy with calling sick people clients, because client to me suggests that you have decided that you want to avail of a service. You go up, knock on the door and say, can I have whatever? But a patient is there not of their own free will. They're there because they have to be. Most of them don't want to be. They'd much rather be at home, but they have to be there for whatever time it takes to improve the situation and get them back home. So I have to say that at all times our focus was the patient, not money as it is now. And that is number one requirement now, is to look at the financial end of things. Cost it out. If we can afford it, we'll do it. If we can't afford it, we won't. And the cuts that have come in staffing have been very stringent, especially on nursing. I suppose Mrs. Thatcher was the first one to introduce this so-called business side of the NHS. And the NHS will never be a business. It is a caring service, and unfortunately, because of the business attitude, caring has just about disappeared down the drain.
Has it gone full circle from Bevan's time, do you think?
Well, it's still better than Bevan's time in that rich and poor can still avail of the service, especially in emergency situations. Everybody is treated the same, and no matter whether you are a millionaire or a pauper, you will get treatment and people will be there to help you. But sadly, on the nursing side in particular, the numbers have been cut to the bone and further.
And morale obviously is gone. Isn't it?
Morale's at rock bottom because those girls who are born carers no longer have the time to care. They're not allowed to care. They're told to get on with it, get out, and really have no truck with the patient, do the job and go.
Well, in your early days in the hospital, in the hospital situation, the doctors effectively ran the hospital, would that be right?
They did.
And did that then change into the hands of accountants or bureaucrats or whatever you want to say?
It was a sort of combined approach of doctors, and we had a whiz kid of an accountant called Jim Henderson, who was very approachable, and if you could explain to him why you needed a particular instrument or whatever that you felt would help patients and why it would help patients, if he was convinced of that, he would move heaven and earth to get you that instrument. And as a medical staff, we sat around a table. We didn't always agree. There were some voices louder than others, but the money was shared around the different departments. If you didn't get what you wanted this year, you were sure that your name would be up the list and your department would be up the list for next year.
A fair equity, would you say?
It was. And at the end of the day, it was patient focused. So, sorry.
No, just in complete agreement. You know, what Miss Law said earlier on, you know, the working of everybody together, that was so effective and just made the place run. For example, so I was in the maternity ward, and then sometimes I would go, before going home, would go ask, particularly one nurse who just passed away a few weeks ago, by the name of Mary McCartan, God rest her soul. Now she was in full control of things, really. I would go to ask, says, what are you doing here? I says, well, I'm going home, I'm here to ask, am I needed for anything? He says, look, you just go home, if I need you, I'll call you. And that was exactly what it was. If she called, or any other member of the staff called you, you just didn't question it. Am I really necessary to travel the distance and come and see you? You knew that they had done their best, and now it's the time that they're not allowed to go any further. It is our privilege to step in and help out. And this went on and on and on, and made life so easy and pleasant, really, because you knew everybody was working together, and they went looking to see, well, if any trouble starts, he's responsible, not me. You know.
But that would also point to the fact that the Tyrone County was very much a community, and it was a community of people helping each other.
Very much. People knew each other. Most of them had grown up, the staff had grown up in the area, knew the patients, knew their families, and there was just that connection, which is so important for people when they're sick. The other wonderful thing about it was we used to have fun. Yeah. There's no more of that. We would have had at least one good laugh a day, and it made life so much easier. We worked so hard. There were times we wondered, would we ever get home? But there was always a funny side to every day. And I mean, it was enough that it just buoyed you up and kept you going through thick and thin, and you knew you would get there sometime.
And because of the nature of the job, you know, every day was different, I would take it.
Oh, absolutely.
You could not predict what was going to happen.
Yeah, there was a routine set out. You knew what your plan was,
Right.
but your plan was very often disrupted by what came through the door at A&E. And the other wonderful thing was that interdepartmental work was just the norm. Over lunch, we had a discussion with the physicians, with the gynecologists, with the skin specialist, with whoever happened to be there having lunch. I've got a patient who's got this. Have you any advice as to what I should do? Oh, I'll nip along and see them. Or we'd get a child in to have his tonsils out. The anaesthetist would check him out and find that he was actually on a list for a hernia or something else surgical. Contact the surgeon and say, this child's having an anaesthetic tomorrow. Would it be possible to do both at once and save him a second anaesthetic? And it happened. Other hospitals are just so big, this couldn't happen.
Common sense no longer exists.
Oh, it doesn't exist. No. No semblance of it at all. We're now in the target era.
Yes.
Well, when do you think that crept in? You mentioned Mrs. Thatcher's time. Did it begin with...
It began there, yes, it did. That's when the business manager from Sainsbury's was invited to look at the NHS. Got the spreadsheet of the financial whatever that comes out at the end of the year, saw that nursing was off the end of the sheet, said, there's where we have to cut. And that's what they've done ever since, cut on nursing, and increase on management. People who have no involvement in the caring side at all, but are there to manage a budget.
That must have taken its toll of the doctors and the consultants when they knew that certain things had to happen or had to be done, and certain services had to be available, and you're staring at a patient and you have to explain to a patient why this is not available or why they can't avail of the best.
It's extremely difficult,
Yes.
yes. And managers are not available to come and explain that to the patient at the time. It very often happens in the middle of the night when there's a queue for theatre, for emergencies, and you need to get in there quickly, and you're explaining to a relative or whoever that
And
we
maybe
don't
very
have the
angry
other
relatives
theatre.
as to why.
Well, usually they're so distressed that they haven't even got to the stage of being angry.
And that flies,
that-
that obviously flies in the face of the way you've been trained as doctors as well.
Absolutely. Yeah.
No, this is the sad thing, that the business people, non-medical people, have taken the position of running the place, and that's why, as Miss Law said, they hadn't a clue about, if somebody has got something wrong, and if there's another thing, another specialty can step in and help. They weren't either not aware, or probably they weren't because that wasn't their job. And that is where the thing, as far as I can see, went wrong, really, because non-medical people came in to run medical conditions of which they're not aware at all what's going on. And if somebody mentioned this needs to be done, they didn't like it because it sort of counteracted their business side of things.
Business plan.
Oh yes, that can't work, But the point is, we are talking about human body, and again, as Miss Law said earlier on, when we were all working together, it's like human body, which is made up of so many different parts. And unless all those parts work together, that body is sick.
Yes. But the people of Omagh obviously sold the lie that somehow this was going to create a centre of excellence somewhere else, and that we would be getting as good as back again.
Sadly, that's not going to happen. I mean, we were supposed to be given a huge increase in outpatient clinics, diagnostics and day surgery, and we were told that in the autumn of 2009 we were going to be so pleasantly surprised by what was handed over to Tyrone County to keep services going for the people. It hasn't happened. Everything is being reduced. Patients are having to travel for their initial appointments. They're having to travel for their investigations. And we have all the facilities here to do that, but it isn't happening. So it's having a huge effect on society.
But what I just recently noticed, I just went round the hospital to see what's going on. But of course, the acute side of things, that have been taken away. But practically every room is occupied by different specialties who are trying to help the people who are coming for different helps. And for example, the cardiac unit in here is just tip top. Then there is the rehabilitation unit, which is run by Dr. Hodkinson, and that place is run like heaven, really, with all sick people in there. And every side, midwives, they have got this place. They try to do scans and things and assess what's going on. Everybody doing their best to see what they can do to help. But they are in titbits, naturally, because of the way things are. And they are 9 to 5. And after that, place is closed, except the rehabilitation unit. So things happen middle of the night, tough.
Well, I have to say the chest pain assessment unit is brilliant. I think Sister Keenan has gained several awards of achievement of excellence in her field, and she has set up a nurse-led unit that has really led the field in this specialty. The cardiologists visit from Derry every day during the week and have given great support to this unit, but without it we would have a lot more people who would have died from heart attacks. They'd seen 1,900 patients in a year last year, and this year, which doesn't end until the end of March, they'd seen 1,600, so they're going to be even more. And this is open day and night, 24 hours, 7 days a week. Anybody can walk in off the street to that unit and be assessed for any cardiac problem. And it's very reassuring, rather than having to drive your loved one to Derry or to Enniskillen in a collapsed condition. So I have to take my hat off to those nurses. They are doing a brilliant job.
And another instance that happened just a few weeks ago, I heard from the sister of the midwife who was involved. One of the pregnant ladies in town, she wasn't feeling well and so on, and she said, well, I ring this midwife who's retired anyway. So the midwife decided to go and see her. When she went there, found that she was in labour, and they got together and delivered the baby safely, and thank God mum and baby are fine. And this is not the first time it has happened. Number of times this have happened. People have come to ask advice, we are not feeling right, and they just deliver on the spot, So we've been very, very lucky that we haven't had more loss and tragedies, as it is wide open. And talking about pregnancy is something which, when the couple hear about it, they're so delighted. But now, regretfully, when what's happened to Tyrone County Hospital and the maternity unit has gone, when they hear, heavens almighty, what am I going to do if I don't feel right, if I go into labour? And that period, which used to be a period of happiness, has become a period of anxiety. And are we serving community well by allowing them to suffer like that? I don't think so.
I don't think so. No, the story has been that big is beautiful as far as hospitals are concerned. But even from a financial point of view, I believe that lessons will be learned, but too late, because small hospitals can take so much pressure off the bigger hospitals. Routine operations and so on can be carried out in small hospitals very successfully without ever joining the queue for the bigger hospitals. With the present rate of closure, the bigger hospitals are totally inundated. They can't cope. They haven't been expanded to take the numbers that are expected to go from the smaller hospitals, and people are just being left.
Well, you know, if you look at it almost if possible from a distance, what is the future for what was the county, and how can the situation be changed, be addressed, and a kind of an equilibrium of excellence brought back to that? Perhaps? Well,
I don't think the county will ever come back. The way that medicine has gone and the way that the European law has directed that doctors are no longer allowed to work more than 56 hours or 58 hours a week. This has led to a huge reduction in availability of medical staff. So because of that, the best we could hope for would be what we were promised, but we don't seem to be getting, which was an enhanced local hospital, which would have large numbers of outpatient clinics, diagnostics, and large numbers of day case surgery coming through. This should have happened a year ago, but it hasn't happened, and as far as I can see, things are reducing rather than increasing.
And that falls at whose door? At Stormont's door? At
the Western Trust.
The Western Trust, the local door.
Yeah.
And is there no accountability? Is there nobody going to stand up and say, this was promised, this is what is needed?
Well, the story of Omagh is paved with broken promises. We just haven't been told what the plans are at any stage. We've been reassured all along the way that this won't happen, that won't happen, and a few weeks later, oh, that's happened. And the beginning of the closure happened on the pretext that there was no nurse available for intensive care cover one Friday night, and there were 8 nurses actually at home at the time, all theatre nurses, any of whom would have been available and could have covered the position had they been asked, but they weren't.
And that provided the link.
And but I think plans were that it should not be allowed to survive, and so it was the same story as Dungannon, and the same story as Kettering, is it, in England, where the doctor from Wire Forest has gone. Richard Taylor is in Westminster as an MP because his local hospital was closed, and he wrote a book about it called From Wire Forest to Westminster. And reading that book, if you substitute Omagh for Kidderminster, it was substitute Omagh for Kidderminster on every page, it's exactly the same story. It's really a handbook of how to close a small hospital surreptitiously.
If you go back to the early stages, it was a case of divide and conquer. It was a case of promise the people, good people of Fermanagh, a hospital at the expense of the Tyrone County, and vice versa. I think if you look back at it, it was all very subtle and all and done in a case of say nothing, that this will all happen eventually.
Yeah. It's a pity because both Tyrone and Fermanagh people need hospital care, and there's absolutely no doubt about it. The best we could hope for would have been that both hospitals would have been maintained, and the second best would have been a hospital halfway between. But sadly, Dr. Hayes in his report decided that the hospital should be in Enniskillen, and Omagh people and Tyrone people in general lose out seriously because of it.
And do you think, it is an indictment of the politicians that happened? Do you think you again looking at it, I suppose, from a distance, was that a legacy of the Troubles where local power was taken away and handed over to basically London controlled? Or do you think had we got our own
government, do you think that this wouldn't have happened, or would it have made a difference?
I really could not say. I would need WikiLeaks to let me read the documents.
Well,
I've no idea.
Of the politicians that it has got to this stage, and that
It's very sad for the people.
And it's quite insulting for the people of this area.
It is.
To treat them like that.
It is.
But
I mean, I've no idea what the thinking was behind it. It was a political decision. It was not a medical decision. And what the politics are behind it, I don't know, and whether we'll ever know.
But the great shame is that that was taken out of the hands of the doctors, who are the professionals who have their ear to the ground and know exactly what's needed, and they know the patients intimately, and to have that decisions taken without that consultation or that acceptance of the knowledge and the understanding that the doctors and the nurses had.
Well, I have to say the doctors did try. All the doctors, both Tyrone and Fermanagh, Dungannon, Enniskillen and Omagh, met together in Enniskillen, discussed the situation as we saw it developing in the late 90s, and Dr. Varma and Dr. Hodkinson went forward to Stormont with a suggestion that a hospital halfway between Omagh and Enniskillen would be the best option, and it was torn up and thrown out. But it would have been the best option.
Had there been a decision then to site the hospital in Enniskillen even before that, do you think? Was a die cast, do you think?
There must have been, yeah. But Omagh has lost out so many times. 1963, before my time, they had plans drawn up at great expense of time for the consultants and the hospital staff, who spent hours after work designing a hospital that would be of top quality to be built on the Tyrone and Fermanagh site. And they had their plans approved and passed by the Department of Health, and the money was ready for Omagh, and suddenly it was taken away and given to build Craigavon. So history repeated itself.
Exactly.
And Omagh lost again. So sad news for the people.
Yes, this is the the sad thing, that people who are not medically trained or informed are put in charge of things. I always say it is like putting me in charge of the electricity board. Next day the place is in darkness. And why? Because I had no idea how to run the electricity board. So the businessman cannot run the health service effectively for the simple reason they don't know what it's all about. Illness, the nature of illness, and how it has to be treated. Because one of when somebody is sick, particularly two things are very important. One is the medication. The other one is the spiritual or social aspect of it. Social aspect comes from the relatives. Now, if the patient is miles away from where the patient was sick, relatives can't go. So that important part is missing. And the feeling of the patient that I've come all this way, and it is terrible. And, it just, instead of being helped, they're being really, getting in the way of therapy.
Yeah.
So.
And I think that, as you mentioned, Mr. Jamshidi, the spiritual aspect is very important, especially for people who are seriously ill. And it is so difficult now for their local clergy to travel from one end of the province to the other, from Enniskillen to Derry, and very often when they do get there, they find the patient has been transferred somewhere else.
Yes.
And they should actually have been visiting somebody else in the other end of the province.
A visit of relatives is so important. when you are not well, lying on the bed, and somebody you know comes through the door.
That's when you really feel vulnerable as a human being, is when you're in the care of someone else.
There's a lovely message, oh, lovely, and that is helping towards the health.
Towards recovery.
But unfortunately, accountants don't see those figures. They don't see that side of the emotional side of healthcare.
No, but one example, we have an old couple outside Omagh. The lady developed pneumonia and was taken to hospital. Her husband visited every day by taxi because there is no bus service that is suitable for an elderly person to use, and he paid £86 a day return to visit his wife in hospital. He was told to apply to the social fund for a reimbursement, but he said no, they'd saved up their pension in case anything like this happened, and he was able to manage the week's visit until she got transferred back to Omagh. But that's a huge expense for pensioners who don't have much. It's very sad. Yeah.
Very sad. You talk about all the elements that I think that occur within hospital. Of course, the physical improvement and the way that maybe the atmosphere and the spiritual element helps towards improvement and the patient's improvement. But that understanding doesn't come from books when you're studying. Can you take your mind back to the first day or the first week when you were the qualified doctor and you were there, the authority, and you walked into the ward for the first time and you suddenly realised the books are over here, it's now down to how I deal with the patients? Was it a scary time for you, Mr. Jamshidi, when you walked in for the first time as the qualified doctor and the nurses looking to you for maybe advice and help?
The thing is, it was, you see, the privilege that has been given to you, it overtakes all that feeling of feebleness and weakness and all that. What am I going to do with this? The fact remains that you, the good Lord, give you the privilege to do what you did. Now you're qualified and you're in a position to do it. And the weak aspect of it doesn't come into it. Now the patient is here. I have the privilege of seeing what can I do with this patient. And of course, you go into the ward as a junior doctor, and if you cannot deal with it, you go and ask the senior man, and ask the sister, ask the nurses who have seen the cases before, and together all work towards the way to treat that individual.
It's a holistic approach, is it?
It's a holistic approach.
Did you find your early days where it was overwhelming to be in the wards and to have that pressure of dealing with all the different patients? And was it tough for a young man?
Tough in certain ways, yes, but the point is to say things are less tough when you know there are others who can carry the burden with you. If you have to carry a very heavy case and there's nobody to help, oh heavens, how am I going to do this? Yeah. But if you know there are other people who can help you to carry this, so the good part of that anxiety goes, and you can concentrate on the way what you can do to help, rather than say, oh Lord, what am I going to do now? And oh, I've had it, I better go home, forget it.
Yeah. So it's back to that idea of community and everybody helping
all working together.
Yeah. And sorry, Miss Law, did you find it the same?
I was totally terrified. Suddenly realised, oh dear, I'm no longer a medical student. This is me. But I looked around me and thought, there's a sister, a ward sister. She'll know what to do. And I don't think there's a junior doctor in the world that hasn't said to the ward sister, what do I do now? And the ward sister has saved many a life with the help of the junior doctor, and sometimes telling the junior doctor when to call for help from their senior colleague. But yes, I do remember the early days very well, and the first few weeks were really difficult time for me. The trouble was I worked in a country hospital where there was nobody but me and the consultant, and really calling a consultant was not just like calling a senior house officer, a registrar or a senior registrar. It was going right to the top, and you really felt quite inadequate when you had to call the consultant. But I have to say the consultants where I worked were very pleasant, very helpful, and didn't mind either explaining to me over the phone what to do or coming in at all hours of the night to help me out. And it was very busy. Sometimes at weekends you didn't see the bed very much, maybe a couple of hours each night and maybe not. And come Monday morning you were still working until 5 o'clock in the evening, and it was difficult to get by. That doesn't happen anymore because of the European Hours Directive, which is a good thing because you don't have the same tired doctors trying to provide the service. But they miss out on the continuity of care. They don't see how their patient progresses.
That's right.
And learning as to how the outcomes of their treatment have worked. That is lost. So it's a bit difficult.
As in so many professions, there seems to be no common sense anymore. I mean, common sense would say you shouldn't work more than 55, 60 hours a week, and the odd time maybe it doesn't do any harm. But in your case then, the law is that the doctor can't be on duty for that length of time.
That's right. And, it is overdoing it, because in the likes of my specialty in ENT, most of my nights on call I spent sleeping, and was fresh and ready for the next day. Occasionally I would have been up all night, and occasionally I would have had a long weekend where I didn't get much rest, but mostly I did. And it really wasn't a problem. There are other specialties like A&E where people just could not keep going morning, noon and night and still function adequately. But for those specialties that aren't so busy, I really think it's been overdone.
And Omagh was renowned for its ENT service.
It was. We inherited a wonderful service from Mr. Wilmot, who put it on the map. He started the service in 1952 in Omagh, and then started a service in Derry, Dungannon and Enniskillen.
And trained from the county as well, trained other people?
And trained, yes. It was the first hospital outside the Royal in the City in Belfast, which took junior doctors, junior surgeons in training. And every year a registrar came down for a year and worked with Mr. Wilmot for the year, and then moved on to higher things. So he did put Omagh on the map very firmly.
What was Christmas like in the county hospital? What was it like around that time?
Christmas, well, for example, in my case, because I'm not from the Christian background, and I'm a Baha'i, and it says, well, he doesn't believe in Christmas, so he's going to do the work, So,
Sounds
but
like
first
Omagh,
of all, the fact of the matter is that, yes, I do believe in Jesus Christ, but that is on the religious side. But as far as working on Christmas Day is concerned, to allow the others to have the day off was no problem.
And
I
what was
found
it-
the privilege to be able to help
Yeah.
so that they would have a nice day off. Why not?
It was a lovely atmosphere. We had it centred around Mr. Jamshidi's department for the Christmas baby, and the children's ward for those poor children who had to be in hospital over Christmas. But I think they found it quite an exciting day because every effort was made to bring in the party atmosphere, and most of them were well enough to be able to enjoy a little bit of it, however sick they were. All the families came, and Santa came, and
Did the nurses and doctors then go around carol singing, or was there anything like that?
yes, they did. They went round all the wards singing carols and bringing good cheer to the patients that had to be there. And before our time, the consultant used to come in and carve the turkey, but that had gone by the time we arrived.
Can you imagine health and safety?
Yes.
You would have thought the surgeon would have been better placed than the consultant.
Yes. It was part of the regular Christmas entertainment in the county, and patients and staff looked forward to Dominic's visit. And I think he got rid of a lot of signed calendars on those on those visits. They were very popular.
But
So-
the Tyrone County Hospital is well renowned for visitors as well. With St Vincent de Paul would have come round, and other people would have visited people who didn't have any close family or friends as well.
That's right. Yes.
Yeah.
Of course, the county now, the campaign to save the county has been very vociferous and has had some success, but could have a lot more success.
It could
And
have
that
a lot
people
more
are aware of the
success,
message.
yeah. Yes, but unfortunately, the powers that be and those that needed to listen haven't listened, and our hospital service has just been reduced from an absolutely brilliant first-class service to a shell. I hope that when the money is available, this new hospital will be built in the grounds of the Tyrone and Fermanagh. But quite honestly, it's not buildings that I'm interested in, it's the services that are in the buildings. And our old Tyrone County was kept clean, spick and span, and polished by our teams of cleaners through the years. There really was never a problem with it, and although it doesn't look very modern, it's amazing just how much good work was done there, and I would have hoped that it could have carried on. We need the services. Buildings are secondary.
Yeah.
Is the campaign to save the hospital still alive, or does it?
It is still alive, yes. The campaign group still meets regularly. I believe our councillors are working to try and secure the promises that were given. And I've noticed that there was a young lady who has started a Facebook group for the county hospital as well, and she had hundreds of people signing up to it in her first month. So that was just local press. I saw that.
So many people owe their lives to the Tyrone County Hospital in this town yet. I mean, it's unfair what has happened. It really is unfair. But I think we've been victims, but we can't remain victims either. We have to try to look to see what we can gain from this. And do you see any positive things in the whole situation at all?
Well, I have to take my hat off to the ambulance service, who have worked extremely hard to try and make sure that people make it to whichever hospital they're going. It's not an easy journey in either direction, and for people that have to travel to Enniskillen, if they're not sick before they start, they're certainly sick by the time they get there, because the road is so bad. But as I say, the ambulance service and the paramedics, although we only have one of those instead of three, have done their best to keep the service going. And with the help of the chest pain assessment unit in the county, fortunately people who have developed coronaries have been saved who would not otherwise have been. But whether this service can be improved on and rolled out so that everybody knows about it, I don't know, because it's been a brilliant service.
Yeah, you know, I think indicative of the feelings that people have for the county, I suppose. I saw it when I have an aunt. My aunt is 88 years of age, and she had been a theatre sister. And when she talks about the county now, she's in hospital now herself in County Donegal. It's the tears, and it's a mixture of anger and sadness that the county is still alive in her mind, and she
Yes.
remembers her days there, and it's so cross
Yeah.
and so sad at the same time, you know, because she had an intense love for the place, and buildings are just buildings, but it's people.
It
And
is
she says the
people,
services,
yeah.
and when she talks about her time there,
Well,
it's alive.
it was run like a military establishment, really. It was, you know, under the iron rod of the matron, and everybody was afraid of her.
Yeah.
Both consultants and nurses. and patients. But, she did rule with a rod of iron and went round and inspected the hospital and every patient in it, morning and evening. And heels were clicked and bed wheels were straightened, and there was not a speck of dust to be seen around any of the wards while the matron was in charge. There have been attempts to bring back matrons across the water, but actually they haven't really made any effort to bring back the proper matron.
Did the role of the matron, when did that begin to dwindle?
Disappeared in the early 80s, late 70s, early 80s, yeah.
And the matron would have worked her way up from being a nurse, I take it?
Oh, she would, yeah. She would have come up from the ranks, knew the whole story of student nurse training and the things they could get up to, and knew what to watch out for, and knew what was possible and what wasn't possible. But the standards were high and they were maintained. So anything that fell below her standards was immediately pulled up, and the ward sister was brought to book and told exactly what was needed, and it had to be sorted. And as I say, the consultants were terrified of her as well. It was when she called them to her office, it was for a good dressing down. Can't do this with my nurses. So
she was the sergeant major of the ward.
She was, yeah. But it worked.
And sadly missed. It can be a figure of fun and
carry on movies,
etc. But that's nonsense. But the reality was that they kept the machinery well oiled and with the discipline, and that part of that hierarchy then that emanated from that.
And cleanliness was top of the agenda. We just didn't have the infections that are so rife now in hospitals. But I think that's partly due to the fact that they have reduced the numbers of beds to such a degree that the beds actually never have time to cool. It's one patient out, and very often nowadays if you get up and go for a shower at 6 o'clock in the morning, when you come back your bed is freshly made up and it's not for you.
Yes.
So you go and sit in the day room until you go home, and somebody else is in your bed by 6:30 or 7 in the morning.
And again they sublet all the cleaning of the hospital out to contracts as well, and again it was all price driven as well, as you said.
Yes, the targets came in, and huge amounts of money were spent trying to achieve these targets. Money that could have been better spent in the NHS, improving the service for everybody for the future. But managers were under pressure to achieve the targets, however they achieved them. And the money that was thrown at the NHS by the Labour government was endless.
And wasted.
Sadly we have talked quite a lot about negative side of what's happening and so on, but there are lots of positive things that are happening, because as I said earlier on, every level of the hospital floor is occupied by different people coming and serving the community. I was surprised there were so many of them, and what of course takes place, the Department of Chiropody in the TNF and the clinic that ENT they use, and they are all in full force working regularly, and it's lovely to see it. And
it is, but I have to go back on another negative. I forgot about it. Private finance. This is just scandalous. The NHS went boldly along into the noose of the private finance. They build hospitals and they cost whatever million. They're then leased back to the NHS for 25 to 40 years, and by the time they're paid for, it costs actually 7 times the original cost of building the hospital. So a hospital that cost 300 million to build will cost 2,100 million at the end of the time. And that's all been costed by a Professor Scholl from Manchester University. She's finance and economics, and Dr. Alison Pollock from Edinburgh University, who have watched in horror as the number of beds has shrunk across England and Scotland, and the amount of money being paid back on private finance contracts has gone through the roof. And the Labour government legislated on their second year in government to make sure that the private finance money took the first slice of the NHS budget every year. So they are guaranteed their money.
First call. Yeah.
Yes. And places like Coventry Hospital have had to close wards and theatres to pay the rent.
Just before we let you go, what is the future for the NHS, do you think, both of you?
Well, it's overachieving, if you like. It's made so many advances that it can hardly manage to keep up with itself. I have to say the day surgery procedures have improved the service immensely, in that many procedures can be carried out during one day without an overnight stay in hospital, and therefore at much reduced cost. Laparoscopic surgery has made great advances. Catheter surgery in cardiac patients to open up blocked arteries and so on has been fantastic. It can also be done as a day procedure. So all the time procedures are improving, advances are being made, but everything costs money. And so it is just very difficult to keep up with the advances and to provide everybody with the care that they need. But I think we've got to keep trying, and only in that way will we ever achieve anything.
Yeah. Sad to see the changes, but we can't stop change.
Oh no,
Change.
we can't stop change.
It goes on.
But as long as people have an equal share of the cake, I think we won't complain.
Change for the better
Change for the better.
is the statement, I think.
Yeah.
And I think all the sides should get together, that's medical, non-medical, and consult together. Because we have saying is the spark of truth cometh forth only after the clash of differing opinions, and that should take place, and nobody should be looked at as he has nothing to offer, don't listen to him, because everyone has something to offer. So listen and learn and make the decision after everybody has expressed the feeling.